I'm Jerry Milner. I'm the Associate Commissioner of the Children's Bureau with the Department of Health and Human Services. I think it's important to recognize that simply because a family lives in poverty does not mean that children are being maltreated. We can't confuse those two concepts. However, it is a fact that a large majority of our children come into foster care from very poor families. It's incredibly unfortunate and depressing that we are so willing as a system to pay someone else to care for a child in a foster care situation, or to pay for therapy to try to undo some of the damage that's been done, as opposed to try and support a family to keep that child safely under their own roof, or to give them the kind of a roof that they need where a child can be safe and protected and feel connected to that family. Unfortunately, in our child welfare system, that's our typical response. And inadvertently, I believe that we exacerbate the trauma, and then we are faced sometimes with years of trying to help children and their families put those pieces back together. My firm belief is that we have many, many children in foster care right now, however, who could remain safely with their parents if their families were able to get the kinds of support and the kinds of services that they need in order to care for their children in safe ways. When we remove a child from a family, even if it's justified, that's an added loss for a child. That's an added bit of trauma that may take years in the making to try and correct or try to ameliorate in some ways. There are examples of integrated human services agencies out there where the whole housing part of the puzzle is a part of the broader system. But even when those systems, those public systems, are not thoroughly integrated, I think we're missing a tremendous opportunity when we're not trying to come together with a joint vision of how we can support families across agency lines, pool our resources, pool our thinking, pool our efforts, so that collectively we're able to meet some of those concrete needs of children and families. Unfortunately, it is those concrete needs, or the absence of those concrete needs, that so often leads families into the doors of the Child Welfare Agency.